Hey, Rhonda, thanks for joining me this afternoon. Very excited to talk to you about you and your business. Without further ado, can you kind of tell us a little bit about your background and how you got into your business? Because it's a very interesting story.
Yeah, sure. I'd love to. Thanks, Eamon. So my name's Rhonda, and I got into coaching consulting about 10 years ago. Prior to that, I was a registered nurse. I worked in surgery, and 10 years ago, I had an opportunity to help a company who was just drowning in health insurance costs. And I came in initially as a nurse, and I helped the employees with root cause of conditions, help them redirect healthcare. So they were right sizing healthcare, going if they needed to primary care and they were going to emergency room, I would correct that. And then I really found that I needed some tools to better communicate with the people and help them determine what it was that was best for them, not me tell them what to do, which is what you're kind of trained to do as a nurse. And so I went to the Duke training program for national board certified health and wellness coaches and did the whole course and certification and got licensed and really found that to be helpful in really meeting the individual where they are and helping them find the solution for their own um, places where they feel stuck.
Amazing. So, really great that you're doing that. Obviously, healthcare is a huge, maybe controversial topic in this country. So, can you kind of talk about how you had some really early, you had success right away, and
I did.
then now 10 years later, you're really growing this enterprise. Can you talk to us about that progression?
Yeah. So the my pilot company, I had no intention of staying for more than a year. In fact, when I went into that company 10 years ago, I said I'll stay for a year. I put up an on-site clinic and I met with the patients as a nurse. But there was so much more to people than their health. Even though health is part of it, there's just clear more parts and it's more complicated than just addressing health. So I went and I got the coaching and really began to love what I was doing. And the needle was moving on people's health. And it was really rewarding to see. And that company was able to grow from, in 10 years, it grew from 200 employees to 750 employees. They were all across the US, in Guam, Hawaii, so I was working virtually with all of the employees. I met one on one. I hired some help, and she was also a board certified coach. And we met with every employee every quarter, help them make a health objective. And then by meeting those health objectives, they earned credits towards their health insurance premium. So there was definitely a carrot stick model. We had really high participation. But because of that, we drove costs just way down, like significantly. The company saved millions of dollars by implementing our services.
That's incredible. And now you're working with companies, all over the country. Tell us a little bit about that.
Yeah, we're a little bit everywhere. We're in Utah, California, Texas, Arizona, Wyoming, Montana, Louisiana, Georgia. We got a little bit of everywhere. But it's all can be done virtually now. And our the premise is that we work with employers and we help them make big, smarter changes in in a culture and climate where they're worried about their employees knowing what to do with those changes. Moving healthcare is kind of like moving a home, a household, or changing jobs. It's a heavy lift. It's not fun. So when we come in and recommend those changes, we're there to support, do the heavy lifting, help all the employees transition to this new program. And then what we do, what's maybe different about us is that instead of in a time when you've got an app for that or go to this website, just log in to your portal, people kind of get lost in the mix. Average patient portal usage is less than 10%, even though it was mandated by the Affordable Care Act for every provider to have a patient portal. They don't know how to use them. They're there to interact, all of these things that are tools that are available that people don't use. So we kind of said, let's go back to what feels good and let's do face to face or virtual meetings where we're looking at the individual, we're talking to them, we're answering their questions. And then we do something called no only warm handoffs. So if there's a question and they need to log into their patient portal, I'll have them share their screen and help them log in, help them find their explanation of benefits, figure out why it's not being paid, and then call their provider with them or call the insurance company with them. And we get that problem solved on the day that it's brought up, not you just got to go log into your patient portal and figure it out. So we're hand holding, but it's also feels good to have an advocate, somebody who's like really going to help you figure out and navigate this system that is confusing at best.
I mean, that sounds like an incredible service, and employers that are looking to take care of their employees, probably flock to you. And then on top of it, you layer on massive cost savings. What for a company that maybe has like 100 to 150 employees, like what do those cost savings kind of look like on average?
So let's, if the average per per employee per month healthcare premium in 2025 was around $1,400. That's including, you have to consider several of your employees are going to be insuring their spouse, their family, they'll have dependents. But that's $1,400 is kind of the average. Our company does an assessment to help your company know where you stack up against your industry, the size of your company, your geographic location. That's a service we offer for free to help people know. But let's say you're paying $1,000 per employee per month. I'm very confident looking through some claims data. Usually I can find a couple 100,000 in pharmaceutical claims I can knock off right, in 24 hours and just get those taken care of and out of the way. So savings, if you're paying $1,000, you have 150 employees, you can do the math on that. It adds up. And if I can save you $200 or $300 per employee per month, that's money, that's big, that's a lot of savings. And every dollar is actually a dollar you have in your account. If you are a company and you make a sale, your margins might be, if you're lucky, might be over 20, but often that's less than 20%. So you have to sell quite a lot to get a few dollars in your bank. But when you save on healthcare, that is a dollar that stays in your bank.
Hmm.
So we save, I mean, if we had an example, could pull the math and do it. But for a company the size, 200-person company, we were easily saving $1 million a year.
Wow, that's incredible. I'm sure a lot of business owners would jump at the chance to save $1 million. How how is your team and the company currently set up? How many employees do you have? I know you have a network of contractors as well. Talk to us a little bit about that.
We have a lot of 1099, about 40 sales people. We have marketing guy as operations person building the back end, some investors, a team of coaches, a couple nurses, and a provider who all, and then we kind of bring in additional resources as needed. If we look to the community for resources when we're trying to help someone. So we don't always need people. We can look to the community to help. So it's not huge, but we're also just at the threshold of growing. We've been in a growth mode for about 6 months, and we're just at the base of the hockey stick. We anticipate 150,000 clients in the next 2 years.
Wow, wow, that's a lot of clients.
We're building the machine to support that.
I like it. I like it. What type of technology or tools are you using to build that machine? Is there something that kind of stands out, or talk to me a little
So
bit about
what I built looked probably a lot like a technical duct tape and straws. It worked, but it was a lot of, I put together the back end with like Airtable and Stacker and Zapier, and just it worked for me. So when we decided we're going to take this big, we needed to create some kind of platform that could grow from 0 to 150,000 members in a short period of time. And so I brought a guy in. His name's Jake, who did that with another client. Went from 0 to, I don't know, 60 billion in revenue in 2 years. I don't know how many clients they had, but he built the engine. And so that's what we put in place. And I have no idea what he uses, but we look at it every week and it's really cool.
that's great. Jake's doing
Coaches love it.
Jake's doing something right, huh?
He knows what he's doing.
When you think about innovation and innovation in healthcare, what pops out to you? Is it your business? Is it something else? Tell me about that.
There's so many things that come to mind. Innovation in healthcare. You'd think that in 2025 we could have figured it out. But I feel like innovation is actually holding us back in healthcare. Let me give you an example. I have a son who's an ER doc, and he is encouraged. He's new. He's a baby doc, like 2 years into um, his career. They want him. He's part of a network of doctors, and the doctors are contracted with the hospital that he works at. And they have a quota of the number of like procedures they need to do in a week. It can't be too many, but it needs to be enough. And they have to meet that quota to get their full compensation. And they want him to use AI every time he walks into a patient room to record, and then the notes are written for him. And he does not want to do it. He is just pushing back. And I was confused. I said, "Why don't you want it? That seems so cool. They write your medical note for you. They, help you know what tests you need to order." And he said, "But if they came in for a broken foot and they happened to mention that they had a cold last week, now all of a sudden I have to do a whole chest workup, lung workup, CT scan, or if they come back in a week with pneumonia, I'm going to get sued." So he can't just fix the leg. He has to do everything that they might have mentioned in that AI. And he hates it. So he won't use it. And
Wow.
it's increasing our medical costs, increasing the waste. So I don't see that innovation is helping us as far as fixing the medical problem. What we need is people who to be seen, to really see someone as a human, complex, who needs guidance and help. And we have lost that.
That's incredibly interesting. That's incredible. So you kind of talked about a challenge in adopting technology. Your son is a clear example in that, but maybe for good reason. Do you see challenges when you talk to business owners or the company's employees in adopting, what your company's bringing to the table?
Yes, I don't come in gently in the night. I'm going to come in and I'm going to make changes that are going to have impact. I'm going to recommend a change to your plan. You can keep your broker. I like brokers. I'm not a broker. I'm not an insurance company, but I know how to build a plan. And I know how to build a plan that's going to serve your people and address their pain points in a way that have not been addressed before. And they're going to really be excited about it. I can get anybody excited about a health insurance plan, and I know how to build them, how to put incentives, copays, things in place to kind of direct healthcare in the most cost efficient but most effective way. So there's going to be disruption, but I also come in with the promise that my team will do all the heavy lifting. We're going to take all the questions. We're going to do a face-to-face open enrollment and make sure that everybody knows who to call and that their phone number is in the contact is in their phone. We're going to work with their employees quarterly because we're going to address some of those root cause issues, really investing in what I like to say, investing in the dirt, investing in the soil, because that's what really changes the patterns and the culture of a company over time. And the hardest thing to do is convince an HR person that it's time to move, that they are leasing and they're in a crappy lease and it keeps going up 20% every year and there are better options and it's time to move, because moving is traumatic. Nobody likes to move and they don't want to do it. That's our biggest hurdle is HR, and for good reason.
How do you overcome that hurdle in HR?
A lot of conversation, a lot of education. Get the C-suite involved, the CEO, the CFO, who are bleeding and saying, "But anyway, change is hard." And when you are responsible for the human resources of a group, no matter how big, that responsibility of who's happy and who's not is on you. And I don't think healthcare was ever intended to be managed by businesses. And yet that's where we find ourselves. And by default, that's become an HR problem, but they have no training in that. And so I try to let them know, hey, we are your health care advocate. We are going to answer all of the insurance healthcare questions so you don't have to. We understand your plan better. We understand how the healthcare system works. We can educate your employees more efficiently. Not having someone on your team who understands healthcare when your second largest cost arguably is healthcare is like not having an accountant or not having an attorney. It just doesn't even make sense when you think about it.
That's very well put. You're right. It doesn't make sense. It's funny that you say that. I'm thinking of a couple different businesses that I work with that probably could have somebody take a look at their healthcare. Is there like an ideal industry or type of client, or is it just anybody that any type of business that has healthcare you can help?
So I 6 months ago, I would have said my ideal client is ready to self-fund or is self-funded. So they are not on one of the Cigna, Aetna, United Health. They are have a stop loss and a TPA, third party administrator, pharmacy benefit manager, and a network, and it's all not from the same company. I 200 people probably self-funded. Perfect client for me. But with the need that has come forth in the last 6 months where we've decided to grow, I mean, I have a client all the way down to three people who just need a decent health plan. So we've changed. We have like different models, different products, so to speak. Under 50 don't technically have to be insured. They're a different product than our 50 plus. And a 50 life group maybe isn't ready to self fund. So they're a different product than our groups that should be self funded.
So is there different cost savings for those different groups, or is it like there's more? Obviously, the per unit cost is gonna be, is the per unit cost different per the different groups? Yeah, talk to me about that.
Yeah. For under 50, we do a flat fee or a flat per employee per month fee. And we just kind of, we just do all the heavy lifting as with regard to healthcare. Very personal touch, high touch program, proactive, not reactive. So we are getting in front of claims, getting in front of them before they happen so that we can kind of direct traffic and help mitigate costs. And then and negotiate cash even often if we can. Even we can even do some reactive, but proactive is much more impactful. So that's a small group. They're going to be a flat fee. A larger group, I mean, I've now this last week taken a group self-funded where they have 55 lives. And that's like, well, that's, self-funding is for big companies, but self-funding is actually no different than a fully funded plan because it has the same cost savings in place that a regular fully funded insurance has. Insurance company calls it a pool. Self-funded calls it a stop loss, and you can determine what's your risk, what's your maximum benefit. You know, going into a year what your worst case scenario will be, and you can plan for it. And you can make that whatever you want in a self-funded plan. You can say, I don't want it to cost more than 10,000, and you might pay a bigger premium, or I don't want my plan to cost more than 100,000, and you're going to have a smaller premium. But you have a lot of control. So I definitely can bring a company who has the ability to have a little flexibility in their week to week bills. Because with a self funded plan, you're getting a weekly bill on the claims that were paid.
Interesting.
So there's some volatility, but you'll have a week where you have nothing and a week where you have a little more than you thought. And if you initially self fund, the first couple months are going to be empty. There's not going to be a lot of claims because claims get paid 60, 90 days later. So you'll build up your reserves in those first few months to be able to take that fluctuation week to week.
And are the size of businesses like, is the proportional savings different? Like, could you find $200 per employee in savings in a smaller company, or is that like, how does that work for the actual business?
So for the actual business, so if I do an assessment on a group and I don't see like just blatant things that need to be addressed, and they have a decent plan, I'll tell them, you've got a decent plan. There's not a lot I can do for you. We have a model where really for that 50 plus size group, where we can either do a percentage of savings or you pay nothing upfront and we're going to take a percentage of your savings. So whatever your per member per month average was in 2025, for example, we're going to get that down $100, $200, $300 per employee per month and take a percentage of savings. The other model we have, which I actually prefer because it's a little more, it's cheaper. It's cheaper for the employer, is a flat fee that we guarantee. So if our flat fee is say $100, if your per member per month isn't $100 or more dollars less than it was last year, then we pay you back.
Interesting.
So there's no risk.
Very cool. Very cool. It's a great offer.
We're highly motivated to save money.
Yeah.
That's how we get paid. And if we don't, we shouldn't be there getting paid.
How do you measure success? I think I already know the answer to this, but is it just purely how much money you save? Is that how you measure your success?
Well,
Or is
that's
it
how it's go ahead.
or is it employee health improvements? Like, do you track like the health improvements, pre-Rhonda and post-Rhonda? How does that work?
We do track so many metrics. We want to show the value in as many ways as we can. A CEO is going to measure based on dollars. Do this, it gets me out of bed in the morning. I love it because I have just seen so many lives dramatically change for good. And I've made so many friends. Like when you're meeting with somebody every quarter for half an hour and you're talking about their health and all of the complexities of that, which involve, emotional and financial and spiritual, all of the components, you become friends.
That's really cool.
Yeah, I love that.
Where do you see you and your business in the next 6 to 12 months?
Well, I think that we're ramping up for something huge. I mean, we're building the structure to grow big, and I expect that we'll be bought.
Awesome. So
We'll
you're
build the engine and then be bought.
exciting, very exciting. If there's one obstacle or something that would prevent you from getting there perhaps, or some issue that you're dealing with now that you could wave a magic wand and just get rid of it, what would that be?
Fear, fear of change.
Is that in the employees, the business owners? Who's that? Is that your team?
Um, my team doesn't have fear of change. We embrace it. We can see that change is really what moves the needle. Our clients are fearful. I mean, there's a lot of reason for them to be fearful of anything that says, "Oh yeah, we can save you money," because it just doesn't come true most of the time. And I cringe when people talk about wellness programs because I kind of get lumped into that category, but that is not at all what we do. What we I don't want to be classified as a wellness program because wellness programs don't work. Nobody participates in them. There's an app for it. There's things you have to meet, but they're um, like you don't understand why or what or how to change it. So you just kind of go screw it. I mean, there's times I've been on a plan where you got to log into an app every day and record your steps to earn like 10 cents. Like I'm not going to do that. So I hate being lumped in with wellness programs because what we do isn't a 5 to 7% participation. It's an 85 to 87% participation. And we really change the trajectory of their culture, business culture, and of the individual's lives and their family.
Very cool. Very cool. Do you have any advice for anybody who's, starting off as a coach or consultant and wants to get to where you are today?
Call me. I'm ready to hire you. I'm looking for national board certified health and wellness coaches, and we salary. So coaches, it's a hard gig. I knew going in what I was going to be doing when I went into that program because I was already an RN. I already had a master's degree in nutrition. I just wanted the tools that I knew a coach program could have, and I wanted to be able to access the bill codes with the NPI number. Because if somebody's doing like a 125 plan, my program adds legitimacy to the FICA savings with the billing. So coaches, because bill codes aren't widely used by the big Blue Cross, Cigna, United Health, coaches have to find their own clients and get, a cash pay client. And hard to get a full-time job doing that. It's definitely possible, but I want a salaried full-time position, make a difference in people's lives. Call me.
If anybody who listens to this wants to call you or look you up or look your company up, how and where can they find you?
So
You don't have to say your phone number, but
I'm
maybe
not
your
going to
what?
say my number. www.weltrio with one L, WELTRIO.com. And there's a contact number there and we'll get you connected. We are hiring. We're hiring coaches, nurses.
I mean, you're expanding, so you need to hire. That's great. I wish you guys the best of luck, and I hope the next 6 to 12 months go smoothly as possible and you guys grow to that goal of 150,000, And also I appreciate you taking the time to talk to me today. Thank you so much,
Yeah.
Rhonda.
Thank you. Appreciate it.